Can cholesterol-lowering medications cause diabetes? That's the big question today. Diamond Fernandez here from the Heart Fit Clinic, your leaders in heart health, and today I want to talk about cholesterol medications. I am a big fan of medications early on in the disease process, but as you start to improve your heart health and do things, there are some, any medication that you take, there's a risk-benefit ratio. So the risk should be outweighing the benefit of that drug. And so anyway, what I want to talk about specifically was a study that was done in diabetes metabolism research and reviews, and it was just done recently. And with this study, they looked at 4,000, almost 4,700 patients of men and women who were candidates for taking statin medications because of their heart disease risk. And what they found was that there was a double placebo versus the people that are actually taking the medications, that there's a double risk of developing diabetes. And so, there's a lot of data out there that's showing, and it is consistent with other aspects of things in terms of understanding diabetes risk. But the question really becomes then is that should you be taking a cholesterol-lowering pill? Now, it depends if you have high risk factors to disease, or it depends if you have established disease. And so if you're taking this for prevention, something to look at it is important is the number needed to treat. How many people need to be taking that medication for one person to benefit? So that'd be the first step. And then the second thing would be very important to understand is the number needed to treat for those people who have established disease. And so I just don't like these numbers. I think, to me, it goes well beyond cholesterol, and there's lots of things that we should start to focus on other than just, I think we just so narrow focused on cholesterol because that's what many doctors can control is the prescription pad. And so if you take your medications, at least then we don't, I think there's just more that you can do, and that's what we do in our clinic, and we can go more in depth with that. But from a prevention side of things, and this is where this study came from, it also talks about these were more candidates that were for statin medications with a high heart disease risk that had not yet taken the drug before. Depends. To me, it's important looking about the size of particles, and so particle size becomes very important to looking at. You have the golf balls versus the tennis balls, which are large and fluffy, and so the golf balls are more atherogenic or plaque causing. So I think that's important to look at. So particle size, I think, would be very important to look at, and then understand really what more can you do, because I think cholesterol-lowering medications, to take it lifelong when you've not had a heart attack, I'm on the fence with that one. If you have established disease, the literature shows better, but then again, it depends what you're going to do and how aggressive are you going to be at preventing and reversing heart disease. Anyway, I can talk all day long about statins. I have webinars that you can watch on statins, but I'll stop it there for today, and make sure that you focus on your heart health, understand your particle size risk, and understand the number needed to treat for you. What is that? How many people need to be taking that drug for one person to benefit, and understand the benefits versus the risk of taking any drug for that matter. So those are the big important takeaways from this. Diamond Fernandez here from the Heart Fit Clinic. Make sure you hit the subscribe button above or share with your friends and families, and I look forward to helping you live happier, healthier, and longer.